With support from Prevent Blindness America and the CDC, the New York State Department of Health recently focused attention on integrating vision efforts into statewide public health systems. Kim Kelly from the department is joining us to share their experiences. Ms. Kelly holds the position of Public Health Representative and Diabetes Prevention Program Coordinator for the New York State Department of Health Diabetes Prevention and Control Program. It's a very long title. Before assuming this position, she worked at the Department of Health as a vision integration specialist. Ms. Kelly?
Can you at least see the top of my head? Happy summer, everybody. And I would be a very bad public health representative if I didn't take 30 seconds to let you stand up, stretch your arms, move them around. I'm serious. We do these in our meetings. Stand up, move around, shake, shake, shake. I'd sing for you, but there's no music, so there you go. So John couldn't have set this up any better, and he was our project officer for this project, and he was fantastic and gave us so much of the momentum and energy that we needed to identify what we wanted to do in New York. And I'm going to move this just because I can't stand that picture. I got my own baggage problems. But to tell you a little bit of a story before I go into the presentation, because I just think it's easier and probably quicker, that part of the impetus of this project was born of a New York State chronic disease epidemiologist. His name is Chris Malin. And he had a personal reason for wanting to know what was happening in our state with visual impairment and the prevalence. And he was able to secure funding to get 3 years of data from the BRFSS and ran the module, the Visual Impairment and Access to Care module, which looks like it's discontinued now, which I was not aware. Because that was going to be one of my points, is that if you can do it, do it. So we were one of the very fortunate states to have 3 years of this data that we could look at and cross-tabulate with chronic disease and figure out what programs in the health department we wanted to approach to integrate a vision health component to their work. And our partnership in this effort was with Prevent Blindness Tri-State, my colleague Sana Savadati, who's moved on from that organization, but those of you who have met Sana and I know that she's here with me in spirit. She was my right hip for the longest time. I think part of the success of what we did was partly because we had an unbelievable chemistry that you can't account for that. We were just lucky. So, feeding off of what John said, we did come at this from two different directions. We wanted to look at how we could integrate messages that would help us prevent the onset of visual impairment, or at the very least, raise awareness of the connection between vision impairment and certain modifiable risk factors. And in the other direction, we wanted to address people with vision impairment and ensure that they were receiving important public health messages and programs and were able to access that information for their own health. The questions that we kind of answered were, can vision integration messages happen in public health programs? Is there opportunity for it? Is there space for it? And considering that there are very distinct lines of funding, categorical funding for programs. And can we share this model with others? And can this reduce the burden of eye disease? And we did not go down that path. We had 3 years to work on this. What we did, we could never say that it was attributable, but we could say it might be contributable to any reduction. So I wanted to just lay that groundwork because I feel like the real meat of this presentation is probably what we did. So these are the things that I'll kind of go over. Why integrate? There, as we've seen from the first several presenters, that there is an increasing prevalence of vision impairment and an association with comorbid conditions, and that there is no categorical funding for vision health. But there is opportunity, and that's what I want to share with you. And that there is a trend now toward consolidated efforts in public health initiatives. So there's a coordinated chronic disease grant that the CDC has given to every state, isn't it, to every state? Where chronic disease programs are asked to really coordinate their efforts. A lot of the health risk reduction messages are the same. And where we can leverage and capitalize on existing resources and manpower and initiatives, we're being asked to do so, and it makes a lot of sense. This is just a definition of integration. We looked at it, and this is a very technical definition, but when Sana and I first started, we approached people by saying, we're not going to hurt you. We're like a benevolent parasite or a barnacle. We're just going to be there. But we're not going to hurt. We're not going to get in your way. We're not going to make too much work for you. It's not going to be a burden. This was the structure of the program. We called ourselves the partnership of PBTS and the state called ourselves the Vision Health Integration and Preservation Program. And I mentioned the goals earlier. The first thing that we did was brought together a collaborative, the New York State Vision and Eye Health Collaborative, or NYSVHIC as we called it for short. This was a pretty broad range of public and private entities. There was a lot of my colleagues in the State Department of Health represented there, a lot of vision health folks represented there, and then some other groups that we thought would make sense for certain, targeted projects like OSHA. We wanted to work on workplace safety and things like that. We went through a whole process of interviewing them using a key informant survey. We surveyed this group and assessed this group pretty much to death. But the reason why we were doing this is we wanted to see where everybody was at. Where were they at with vision health messages? Did they have them? Did they not have them? Were they willing to integrate? Were they willing to work with us? And by and large, the large percentage of them said, yeah, sure, we can do this. And then we interviewed them to find out, particularly from the experts, what their concerns were, where they felt the priority issues were. And we came up with 3 main priority areas, which was prevention and early detection, injury and safety, and rehabilitation and quality of life. And that was kind of the framework with which we began to look for opportunities to do initiatives under those 3 domains, to steal a CDC word. So here's some examples. My first example is a campaign that we got a lot of mileage out of, actually. We started working with the Tobacco Control Program of New York State and told them, what it is we wanted to do, and they actually identified these very hard. Our tobacco program has a history of using very, very hard-hitting graphic campaigns to get attention, and they had identified an eye commercial out of Australia, a smoking and eye commercial where the guy takes a puff of his cigarette in the car, and then you see going through his bloodstream, and all of a sudden a blood vessel bursts, in his retina. And They have a lot of ads like this. Well, they tested that ad, and it tested very well. And they were going to do a multimedia campaign across the whole of New York State, internet, radio, television. We had a little bit of funding that was kind of external to this grant. Well, actually, some was from this grant, that we could do a print campaign in Buffalo. Buffalo was a very high target area for them. So we did a print campaign there. We did bus sides and billboards, and we worked with the Quit line to send out fact sheets to anyone who called, not just in Buffalo, but anybody that called them. We had posters up, we had dioramas. And here's a picture of some of this. This is in an airport, and that's at a storefront, and I think that guy's going, ugh, and that's what we wanted. We wanted people to really take notice. This looks like it's probably the first day of June in Buffalo. Just judging by the level of the snow, it's got to be breaking summer there. And then there's some happy accident that happened recently. The Tobacco Control Program rearranged their website a little bit, and I went back to see if our stuff was still there, and it wasn't. So I called them and I said, hey, do you think you could, that link that we have to smoking and vision stuff, do you think you could put that back under reports, brochures, and fact sheets, which was the web page that I thought that they would put it under? Well, this is the screenshot of their front page. And as you can see, smoking and vision is directly under reports, brochures, and fact sheets. So it is on, and I'm not saying a word, it's on their main page. And they don't have a director or an assistant director right now, so I'm just going to leave it there until somebody figures out maybe it shouldn't be there. These are some results from the campaign and just kind of the spread. We were able to collect some quitline data, and we had an epidemiologist on staff with us look at this data. And we did see a bit of an uptick during the campaign in calls to the quitline in the target population. So that was good news. But most of what we did, we don't really have this end result data. We're really looking at, can we do it? Did we do it? Could we do it again? Here's another thing that we did. It's a 5 key messages fact sheet, and it's really geared toward a little higher level education of providers and government decision makers about the prevalence of diabetic retinopathy in our state and what they need to know. And these were the messages that we wanted to share with them, is that people with diabetes and prediabetes are at high risk for diabetic eye diseases. An annual dilated exam is essential. We need to get the word out about annual dilated exams more. And it's a growing public health concern for New York State, and that blindness and vision impairment are major public health problems, and they have tolls on society and individuals. This campaign we did in collaboration, and so you'll see there's kind of a mix of things we did internally with our colleagues at the Department of Health, and a mix of things that we worked on with external partners. So this was a collaboration with the Chain Pharmacy Association of New York State. And we are doing another 5 key messages, but this is the Diabetes Prevention and Control Program. They decided what these 5 messages were, and the Chain Pharmacy Association is helping us to spread these, well, I'll show you what it looks like. So there are these little, why can't I think of the word, pharmacy inserts, the bag inserts. And we've got 2 supermarket chains, pharmacy chains, working with us right now, and they're on a schedule. So for a couple of months, they'll do Don't Lose Sight of Diabetes, and then for a couple of months, they might do Know Your Numbers, Check Your A1C. And current distribution, and it would be for all of these, is over 12,000. That's for each individual piece. So more than 12,000 of these have gone out, which is great. Another high point or highlight of this project was a collaboration with John and an individual from the American Council of the Blind to deliver an educational module to public health graduate students at our SUNY School of Public Health. And John and a woman by the name of Kathy Casey, who has a visual impairment, presented to these graduate students, and we did a pre and post test. These were the lessons that John shared with them, and they absolutely love John. You can see why. He's a true teacher. But their pre and post scores did show that, and we didn't ask them, we asked them kind of basic vision knowledge questions, things that maybe they could have heard about. And their average score at the beginning, pre-module, was 37% correctness, and then afterwards 71%. And we did evaluate if they thought that this should be a permanent part of the class, and they said, yes, we think this is really valuable. And the professor has since integrated this into the public health and aging course that she teaches. Some other broad activities: we now have a Vision and Eye Health web page on the public website of the New York State Department of Health. I'm not sure if many other states have that. We've been able to run a 4th year of the Vision Impairment and Access to Eye Care BRFS module, and John and Larry Steele, who is our epidemiologist, are working on a monograph, which is the 3rd bullet down of the guidance documents that we're working on. I've been trying to get through for months a Vision Integration 101, the New York State experience, which would be a more expansive document of this talk, and the Vision and Eye Health Integration Plan. These are right now back in the approval process. They go up and they come back with edits, and they go up and they come back with edits. So they're in the approval process again. We did, as I said earlier, a lot of assessments. These are a snapshot you can read later of some of the inventories that we did to find out where people were with their vision impairment work, and how they felt about the integration that we did with them. The indicators of success are, a little bit different. We were asked, could you develop a systematic approach? And yes, we could. We looked at national data. We looked at our local data to kind of drive what we wanted to do. We presented to program leadership the importance of vision health. We had to make it meaningful to our leaders that vision health is an important concern. And we identified projects that we could do. Sustainability was another key indicator of success. I remember doing one project where we did a PowerPoint, and then we said, well, that was a one-shot deal, and we put all this work into it. We really need to figure out things that our colleagues are doing that they're going to keep doing, and that they'll keep us in it with them. We built a lot of partnerships, and we looked at the reach and the output of the integration activities. This is my fancy slide. Identify a champion. This is what worked. Who was it? The chronic disease epidemiologist. Identify an organizational home. Diabetes prevention and control program. Establish a public-private partnership. That was a very strong part of this. People really saw Prevent Blindness Tri-State and the New York State Department of Health as walking in step lock and doing everything in lockstep and doing everything together and really demonstrating a public-private partnership. Build strong foundational partnerships and make integration meaningful to leadership. So we had some challenges and some barriers, varying degrees of participation from our members. We had a lot of great ideas. We definitely didn't have enough time to do it all. Sometimes reaching consensus was an issue, and if it became an issue, we just dropped it. Competing priorities due to funding streams and lack of being able to collect the data that we needed to really be able to see if there was any effect. But there are a lot of opportunities to integrate vision in public health programs, and a lot can be accomplished with very little funding. You just kind of need to find the champions and the people that are willing to make that part of their work, and it's not insurmountable. It can definitely be done. That's it. Thank you.